Good afternoon, everyone, and thanks for attending the School Health Services mid-year training. This is the portion of our training that will cover the random moment, time study, and reimbursement from PCG. Like we said, this is a really small group, so we're going to keep it more casual and really do encourage you coming off of mute, participating in the conversation, and we'll try to keep it a little lighter. However, just to, maybe eliminate background noise, do try to keep yourself on mute. And if you're comfortable having your video on, great. If not, that's fine too. Like Tracy said, the presentations are being recorded. So if you have a team member that missed this or any other of the sessions, they're welcome to look at all or just a part of the presentation if there's just maybe one part that's only relevant to them. And this is the last opportunity to take part in this webinar. So again, look out for those recordings that will be uploaded. And today from PCG, we have with us Andrew Jelinski, Jennifer Miller, John Ward, Rose Jensen, and Lori Bob. From the department, we have myself, Olga Ginchin, and Tracy Gonzalez. And from CDE, we have Omar Estrada. And it does look like we have a couple more people logging on, so great. We will go ahead and get started, and I'll hand it over to Andrew from PCG.
Thank you, Olga. Good afternoon, everyone. Thank you for joining us today. Today, we are going to be going over a very important thing, and that is cost pools. We're going to be talking about what cost pool each provider should be assigned to. We're going to be going over different scenarios and making discussion questions out of it. We're going to be also talking about how you manage your staff pool list and then have discussion based off of that as well. We'll also be talking about how the staff pool drives quarterly and annual reimbursement as well. And then we'll just wrap up at the end. If you do have any questions, just let me know. You can use the chat or just come off mute. We're going to be very open about our discussion, so please participate. So without further ado, we provide acronyms as always, so that way you can understand some of the terms in the PowerPoint. All right. So everyone should know that there is two cost pools that you can providers in. There's a direct service cost pool and the admin cost pool. The direct service cost pool, providers are reimbursed for not only just direct service, but also for MAC activities as well. The providers in this cost pool should be licensed, and they can be selected for licensure reviews each year and for comprehensive reviews when it comes to looking at if they were licensed during a certain fiscal year. The second cost pool is the admin cost pool. These providers can only be billed. They can't be billed for direct service. They're MAC only. A lot of these providers are the non-licensed version of the direct service providers. So they wouldn't get as much reimbursement as the direct service. And we're going to go over some scenarios where we're going to decide where we're going to place a provider, either in the direct service cost pool or into the administrative cost pool. So the scenarios that we're going to go over, we're not going to be doing breakout sessions. Since our group is so small, we can just discuss it as a group. So we strongly recommend that you do participate with us. Tracy is going to be posting a link to our, well, I don't even know, do we need to do the link for the Jamboard? I probably would, yeah, we probably wouldn't need to, just because we're not doing anything with our breakouts. So I'm going to be going over 3 scenarios, and in these scenarios, we're going to have a provider that might be, they could be direct service, they could be admin cost pool. We're going to determine as a group where they should go, and we want to have reasoning behind that as well. All right. So for our first scenario, oh, and did we post a Jamboard? There is a Jamboard link in there.
Yep, I posted it, Andrew.
Awesome.
Just in case anybody wanted to click on it if they're using a second screen, but you're reading them from the PowerPoint, so that's fine too.
Yeah. Okay, so I'm going to go to this scenario, and then if somebody wants to answer the question for me or maybe give me your thoughts, we can discuss that as a group. All right, scenario 1. Erin is a social worker that was recently hired to work with students to perform medical outreach and coordination for students in need. Erin is fully licensed and does perform monitoring and some evaluations as needed. Where should Erin be placed on your staff pool list in the prospective quarter? So I'll give maybe a couple seconds to think about it, and just go ahead. You can unmute yourself, or if you don't want to unmute yourself, you can also use the chat about where you think Erin should go, whether direct service or admin.
Probably direct service.
And why would you say that, Teresa?
Well, she is licensed, fully licensed, and she's a social worker.
Okay.
Students.
But doesn't she, wasn't she hired to do medical outreach and coordination?
Yes, true. So maybe I'm wrong.
Doesn't outreach and enrollment still count towards if you're a direct service provider? Like if you're a direct service provider, you're still providing a health service, even if it's outreach, but if you're licensed for the direct roster, you should be on the direct roster, correct?
Yes. So let's look at, I think the sentence that can really help you on this one is the second one. Erin is fully licensed. So that's a big key point. And then Teresa, you did, I mean, I did kind of backpedal you on the medical outreach and coordination, but is she performing monitoring and evaluations as well?
Yeah.
Yes.
Okay. Is that direct service or admin?
It's direct service, I think.
That's direct service. In this case, in this scenario, we would recommend Erin be put on direct service, and that's exactly why. She can be reimbursed for both MAC activities and direct service activities if she's placed into direct service. Just like you said, Teresa and Jonas, she is fully licensed. So that's a direct service requirement right there. And it does say that she does perform some. It might not be her main, but it's enough for her to be able to get reimbursed for both, because you want to get reimbursement for those activities. So that would be the correct answer, direct service. Are there any questions about that scenario? If you've ever faced that, or if you're not quite sure? That one's pretty easy. We're gonna go to our next scenario. All right, Monica is a new SLP working in her CFY at your district. Her supervisor is properly licensed but 100% federally funded. Monica will complete her CFY in May 2022. Can Monica be added to the upcoming AJ22 SPL? Does anybody have any kind of thoughts right now about this? Or maybe we could break it down together.
I would believe she could be, because as long as she's supervised, she has the right licensure and she's a qualified provider.
Yeah, and there's two job categories that, like, if you were to put her, let's talk about, would she go in direct service or admin if she was to be included on the SPL?
Direct.
Direct, yep. And it was exactly for the reason you just described before, that she is qualified and she does have a supervisor. Now, her supervisor is 100% federally funded. So that means that her supervisor cannot be put on the staff pool. Would that affect anything, or would it still be okay for Monica to be on their staff pool? Has anybody ever run into this scenario before? Everybody's really quiet today.
And
I
I
mean-
would just add really quick that that's one of the reasons why this was added as a scenario, because it is one that came up at least a few times.
Yeah.
Well, my
as
thinking
well-
is that like, if she's a qualified provider on your staff pool list, it would be regardless, like it's the manual says that she has to just be supervised by an SLP with a license, right? So as long as the SLP has a license, there's nothing about it being on your roster or not. Is that correct?
I mean, if you're looking at what the rules don't say, you're 100% correct. The supervisor does not have to be on your SPL. The supervisor also can be paid with federal grants. And this happens a lot. So as long as there's somebody signing off and that is her supervisor, then she's technically in compliance. Now, she's in her clinical fellowship year. What job category would she go to? If you want me to, I can. It's on the Jamboard. It will go over the job categories, and I can also show. These are the
Well,
cost.
we can just give them a couple of options because
Yeah.
it's their SLPs, right? So the SLP options are there's an SLP, there's an SLP candidate, and there's an SLP assistant. There's also a teacher, but she probably wouldn't go on the teacher. It'd probably be one of those other ones. So if you had those three to choose from, what makes the most sense? Because remember the CFY is completed in May, which is right in the middle of that AJ22 quarter. So what's the best place to put her? Or where is the best place to put her?
I mean, if you're, I don't know.
Again, the three categories would be SLP, SLPA, or SLP candidate.
Candidate, maybe?
Yeah, that would be correct. Candidate means that she's wrapping up her fellowship year, and then she can transition into an SLP, fully licensed. She's not going to need a supervisor for that. Now, so that would be AJ22. When can you add her on the staff pool list as an SLP then? There's only 3 quarters you can add people. I guess if you don't know like what quarters come after what, this would be OD 22 is when you can shift Monica over to an SLP. And that way we don't have to check and see if she has a supervisor. She won't need a supervisor once OD 22 hits, if she's still properly licensed and everything like that. So yeah, just keep that in mind about any supervisor that's 100% federally funded, they can still supervise people on your staff pool list.
So just another point I want to make on this one for districts is that you're not losing out by not moving that person from a candidate to a fully licensed SLP. They're still on the direct service cost pool. You're still claiming costs for them. They will be overqualified, for that position for just a couple months. And then technically, I guess, through the summer months, if you count that as well. But then you'll get them moved over for the next time, and that's all okay.
So you're saying as long as, and then if their services came up on a review, as long as you have the proper licensure for what they were during the time of that claim, that would be acceptable?
Exactly.
Yeah, that came up as a good question in another training, and I believe Shannon answered that was yes, correct. And unless somebody remembers differently, correct me if I'm wrong.
Okay, so their provider type doesn't necessarily need to match what, as long as they're qualified, their provider type doesn't necessarily need to match the roster.
They can be over,
As
but not
long as-
underqualified.
Right.
Okay.
Yeah.
Thank you.
Of course.
Does that make sense to everyone else on the call? Or did you have any follow-up questions to that? We got a small group, so we can
Yeah,
take
not-
personal questions if, you know, if
yeah,
if
and
you
we can
feel
always
like-
go back. If you've come up with a question later that just dawns on you, just let us know. We can definitely go back to that topic. All right, scenario 3. Joseph is a clinical social worker with a department, a DORA and a CDE license. His job duties have recently changed to become part of a child find team, which means he does less direct service with students and more coordination, monitoring, evaluating, and outreach. Where would we put Joseph, admin or direct service?
And if you are on the Jamboard, it's the 3rd tab. There's you can see it's sort of like little pages, 1 of 3, 2 of 3, 3 of 3. We're on the 3rd tab.
Does anybody have any thoughts?
Teresa typed in direct service.
Direct
vote.
service? And Teresa, why would you say direct service? You might be on mute, but all right. Does anybody want to give a shot of why, if I was to challenge you on that? Oh, no worries. All right. I mean, everyone's correct. I think the best way to explain this one, again, it's very similar to scenario 1. The key word is that he does less direct service, but he still does direct service. And we got to remember, he's properly licensed. He has a DORA and he has a CD or a CDE. So if he was not properly licensed, he would be a non-licensed social worker, and that would throw him into the admin cost pool. So just because, again, he's part of a child find team, and the main thing is that he does monitoring coordination, doesn't prevent him from also getting reimbursed for direct service if he does any direct service. So yeah, pretty simple. But stuff to think about when you do add new providers on your staff pools. And then we already did our discussion. We're not doing a breakout still, but we are going to have 3 more scenarios. These ones are going to be a little bit more step-by-step ones. We're going to be thinking about you're managing your staff pool when it does come to your cost pools, and when it does come to direct replacements, vacancies, etc. All right. So scenario 1, Mary is an SLPA in the current quarter. You recently learned that her supervising licensed SLP left the district. Mary continues to work with students on her caseload. Please outline the steps you should take to remain compliant with SHS program guidelines. Does anyone want to take a stab at this? Teresa, you might still be with a student. Anybody else? With Chris, Kim, Jonas?
I would say as long as she has another supervisor assigned, then she's good to go.
So I think the first step would be checking, to see if she has another supervisor. Because if she does, just keep her there. Yeah. But let's do alternative. What if you find out there was no supervisor for Mary? What would be the first thing you would do in your staff pool?
I think you would take her off the staff pool list, wouldn't you? Or reach out to somebody, one of you guys, to make sure the appropriate steps were taken.
Yeah, you can always reach out to us. All right, so you did say the correct answer though. You want to make sure she's off your staff pool. Is that a deletion or a vacancy on that?
Vacancy?
Correct. You're going to want to vacate Mary. Now, for what date would you vacate Mary?
I'm terrible with dates.
Mhm.
That's a good.
Oh, no, you're good.
I would say you'd want to vacate her when she becomes non-compliant. When did she become non-compliant as an SLPA?
When she no longer had a director or a licensed supervisor.
A supervisor. Yep, exactly. You want to backdate her vacancy to whenever the supervisor left the district. Now that there's a vacancy here, there are a couple things that you can do with this vacancy. One of the options could be you could replace this SLPA job position with another SLPA, one that does have a supervisor. And then another option you can do is if Mary does get a new supervisor, you could add her back in. And if somebody's replaced the SLPA position, you would just add in a new SLPA position. Again, you can only add in one SLPA for that vacancy, only one person. So Mary might have to be added in next quarter if you did replace that person right away with a SLPA that was supervised. So yeah, those would be the scenarios and those would be the steps you take. Please check to see if they have the supervisor first, like Yana said, because then you just eliminate any kind of work. You can just leave Mary on your staff pool list and she's compliant still. So awesome.
Andrew, if we're through with that one, can we go back to number 2 for just a minute?
2 on the pack one?
Yeah,
one
for
right there?
Monica. Yeah,
Yeah, let's go to
just
Monica.
because we had somebody say in a previous training, another good option that we just didn't talk about, and I just wanted to share it with the group because it could be helpful. But we had somebody from a district say that in Monica's case where she gained her full license to be an SLP in the middle of a quarter, that what they would do and what they have done in the past is if they have an SLP opening in their current quarter, they will vacate her from the candidate role, directly replace her into the SLP role, and then that candidate position is now a vacancy instead of the SLP.
And it drops the requirement for the person that any person that could come into a staff pool. No longer do they have to be they don't have to have a full SLP license. They can be supervised as a candidate. So
right. It just opens
yeah.
up that position for another candidate.
Exactly.
And that was, I thought, another decent suggestion. It just didn't come up. So I just wanted to share with the group. If that's an option,
only,
it's not always an option.
Is that only for candidate? If you make that vacancy, you can't put like an SLPA there, or is it just a candidate that you can put there?
No, because an SLPA has their own job category.
Got it. Okay.
Yeah.
You can plug in an SLP though to the job the candidate position, correct, Rose?
Well, I don't think you would knowingly do that. It's okay if it sort of happens in the middle of a quarter, but you wouldn't want to, just because I mean, when you go to cost report and stuff, you'll get a bunch of triggered edits and things like that. I mean, it would just be a little harder to track on the district side. Not best practice, I would say. That's all. You could bring us to the next section.
All right, scenario 2. Stuart is a licensed SLP working for your district, but you have him listed on your current quarter's SPL as a candidate. This was carried over from last year when he was still completing his CFY. You just realized this and you would like to make the appropriate update to your SPL. When can you make this update? We've been talking about this for a little bit just now. Does anybody know what quarter you can make the update? Can you make it in the current quarter? I'll take the silence as thinking, maybe.
Wait, right?
Have to
I
wait.
thought if you
Yeah,
have to wait till the next quarter.
you do. You do. I was trying to trick you. Yes, you do wait. Yeah, you're 100% correct. You can change a person's job category in an open quarter. This will switch them over once that quarter starts. This would make it so that way you don't have to trigger any kind of financial warnings, and we won't, we we won't have to request any kind of supervisor documents because he's no longer in his candidacy. But you will have to keep him as a candidate for the current quarter. So just keep that in mind. Again, he's overqualified, but that's fine. And again, this happens a lot because you don't get a warning when somebody just completed their CFY. There's not like a big celebration and alarms get triggered or anything like that. So this can happen, and it does happen quite frequently. So just something to keep in mind. All right, and our last piece, if you've already done the training with us in another session, you might know the answer to this question. Allison is a health tech who left the district yesterday and was assigned to the school location of elementary A. You have Gary, a health tech newly hired that you could add to your staff pool list in the current quarter, but you don't have any vacancies at the location he works, elementary B. Should you make the direct replacement now with Gary, even though he'll be assigned to the incorrect location? Or should you wait to the prospective quarter opens to add him as a new position with the current location assigned? So there's two options. Who believes in option number 1 and who wants option number 2?
I mean, I would want option number 1, but my understanding is you're replacing that specific position, correct? Like you're replacing that specific person.
Yeah, in even more specific terms, that job category itself. Yes. Yeah. You definitely, when you do make the direct replacement, you want to pay attention to job category. Would you get in trouble with compliance if you put somebody in the wrong location?
Don't know.
Probably.
That's why we're here. That's why we're here today. The correct answer for this one would be no, you wouldn't get in trouble if you put somebody in the wrong location. PCG nor the department tracks who's where, any location. It doesn't matter. What matters is job category and the correct licensure during that time. Or if they require a supervisor, they have a supervisor. Those are the things that matter when we do check to make sure that you're reporting costs correctly for certain job positions. So if you went with the second option, you could be missing out on some reimbursement because you would not have Gary on the staff pool for the current quarter right now. But if you went with the first option, you would be able to get reimbursed for Gary. He might not be in the correct location. And if you do use locations, I mean, if you love locations, great for you. You can switch his location next quarter if you keep track of that on the side. So the best answer for this one would be answer number 1, make the direct replacement. Job location, the locations do not matter at all. Are there any questions about the scenarios that we went through? Anything got triggered in your head, or if you have any other questions about cost pools?
I do actually have a question that kind of came up recently with me. For providers that aren't necessarily on the qualified like provider list per the program manual, but they still might be accepted in the community, can they be put on the direct service roster if they have the right licensure? So I guess I'm asking, like, more specifically, we had a provider that was, and I'm not positive if it's acceptable in the community for like Medicaid billing, but it's a licensed addiction counselor, and they had a DORA license, and they were on direct, but then they were moved to MAC as like a mental health advocate.
Were they doing any direct service still?
They were doing direct service, but in the program manual, it's not like one of the qualified providers. But if it's I'm not sure. You might have to answer if that's like an acceptable like license type in the community. But if they're like a licensed provider in the community, do they necessarily have to be on that list?
Yeah, the answer to that is yes, they do. They have to be on the list.
Okay, so then like if they're like an addiction counselor or something and they're fully licensed, then we could put them on the MAC if they're still doing care coordination and things like that.
Yes.
But not direct service.
if there's not a job category for them and it's not, those are what's been approved by the department, then that is correct. They would have to go. They could still be on there, but on the max side.
Okay, thank you.
Yeah.
That's a good question. Yeah.
Licensed addiction, you said. I think we have licensed professional counselor.
Mm-hmm.
So I would say, and I don't know that I can answer this question, but I would ask the department then. Those are really two distinct, different licenses. If that's
Right.
the case, then as long as that can't be, as long as there's no umbrella like under the license, the LPC
Uh-huh.
of providers that the department would allow, but I'm not aware of any. So I would throw that to the department.
Okay.
I can look into that, Jonas, and get back to you.
Okay.
I see your question, and yeah, I'll let you know.
Okay, that sounds great. Thank you.
Yep.
All right. Any other questions about cost pools before we move on? All right. We're going to talk about more general SPL management. Again, this still does drive your reimbursement. So whether you work just finance or whether you're just RMTS, knowing how this affects your district is very important. So every RMTS coordinator needs to know how to create vacancies. Vacancies are really important because they do two main functions. One is to invalidate moments that were given to providers, so that way your compliance stays above that 85%. Those moments won't count against your compliance. But the other one is to also create an accurate job span for this provider, especially when it comes to reporting costs. If the provider was on your staff pool list the whole quarter, but they were not actually working, they weren't part of your district, that's out of compliance. You want to make sure you're reporting zero costs on that. The vacancies help you realize when the person's no longer with your district though. So when you do figure out somebody is not in your district, let's say you find out that person left in the past. They might have left maybe 2 weeks ago. You work with your HR on this. Your HR is your best tool finding out when your providers have left. And let's say there was a moment that came up maybe 2 days ago and you want to backdate their vacancy. You can backdate it 2 weeks in this scenario. So that way that moment is going to be invalidated and it won't count against compliance. So you want to backdate it as accurately as possible to the past. If the coordinator or somebody accidentally answered the moment, you can only backdate it to the day after that moment, because the system will not allow you to vacate an already answered moment. I've seen that in the past. It's very rare, but just a heads up. If you are a planning type of coordinator, if you like your stuff done and not have to worry about later, you can also vacate for a future date. And in those cases, it would be something that you know that this coordinator might leave at the end of the month. And you can set a date for the future. And what this will do in your staff pool is that you will see the end date, but the person will stay as an active provider. They will not turn into a vacancy until that future date. So just something to keep in mind. I've had providers wonder why they're not turning into a vacancy yet. You have to wait to the correct future date for that to happen. So that's going over creating vacancies. I mean, you'll be using your SPL and your action bar to do that. The just as important thing is to fill those vacancies, so that way you can continue claiming costs for those job positions. Remember, you got to have the same job category as the person that you're replacing. That way you can stay in compliance with the program. If the person was, if you backdated it, let's say before a provider's moment, and you found out that this person was replaced, and you do a replace with existing or new option in the system, that person that was replaced, their moments now become the new provider's moments. The system will automatically send them the moments, and if for any reason they delete them thinking they're spam just because they're new to the program, you can always use the moments tab to re-notify them about their moments. Again, vacant moments will not hurt or help your compliance rate for your district. So there is some value into getting vacancies filled ASAP and correctly, then just leave them open. But there is urgency to vacate at the correct times and ASAP as well. Otherwise, these moments can go unanswered and they can count against compliance if you weren't able to backdate them correctly. If you are, then no worries. Are there any questions about vacancies and direct replacements for those vacancies? And just remember, all vacancies do need to be deleted. Just speaking to this right now because your AJ22 staff pool lists are open. Vacancies will need to be deleted before you certify your staff pool. So something to keep in mind. All right, and just to wrap a bow on how the SPL does affect your reimbursement, and we'll go over both quarterly and annual. Providers in your direct service and your admin cost pool can report a quarterly admin costs. And remember, this is for both pools, so that's always something to keep in mind when we were debating about the admin or direct service. On the other side, though, only direct service will get reimbursements, and this is in the form. This is in your annual cost report. This is in the form of interim payments. These are determined based off your previous fiscal year's reported costs in only the direct service cost pool. Remember, the admin is only on the max side. The total reported cost is then divided by 12. The state may only give a portion though, because this is due to your SPL fluctuations between the previous year and the current year. And this is more important now than ever because what we've seen during COVID is that there are large staff pool fluctuations. And again, that's just to keep just because of those fluctuations. So, and this is all driven because of your staff pool lists. The random moment time study itself will affect your reimbursements quarterly and annually. So the people that provide your construct your staff pool list, they are important, just as important in the financial aspect of this program, because they're the first line of defense in getting these people the reimbursement that they need. Were there any questions about the reimbursement? We're going to go over how the SPL affects your quarterly reimbursement. All right. So there are certain activities that are MAC allowable activities. These can, again, are reimbursed for both direct people in your direct service cost pool and your admin cost pool. These are activities that only people in your admin cost pool, these are the only activities that the admin cost pool can do though, that can get reimbursement for. They won't be able to do anything in the direct service billing. Something, these are examples of the MAC activities. An example would be anything that would assist in the direct service portion of the RMTS program. This could be participating in meetings, helping get students enrolled in the Medicaid application process, preparing and sharing information about medical and mental health related services, conducting trainings, etc. It's, again, anything that can support direct service without doing the actual direct service itself. And then just to reiterate, direct replacements are important because it allows you to continue getting cost reporting. It captures costs for that job category, because otherwise, if you just leave it as a vacancy and wait till the next quarter to add a new job category, you missed out on that that cost reporting for, it could have been maybe a couple of weeks or even a couple of months. So always keep that in mind. You want to fill it with an eligible staff member, somebody that has the same job category and would have the licensure and maybe supervisor requirements as well. This improves your RMTS compliance results as well. So it has an extra benefit of that. So yeah. Is there any questions about direct replacements before I turn it over to John? All right. I'm going to turn it over to John for how the staff pool list affects annual reimbursements.
Cool. Thanks, Andrew.
You, Andrew.
Do you have a question? Oh, no.
All
I
right.
guess not.
Yeah, so I'm just going to be talking about how really the SBL and RMTS tie into the annual side of the program, so your annual cost report and cost settlement. So first off is just appropriately managing your SBL and how that directly affects your program reimbursement. So this is important, as you may know, just because whoever is on your staff pool list for annual, your direct service staff list are going to be the only folks who show up on your annual cost report. So if there is a mistake in, let's say you have an occupational therapist accidentally in the administrative cost pool, that's going to affect your cost base, meaning you are going to be you're going to be able to report less costs than, again, if your staff list was correct. So that, as well as just the job categories, again, making sure that the job categories match that provider's licensure as well. So all these things affect your cost settlement. It can also affect your paid claims or your interim payments, more specifically if kind of the data that PCG used to calculate your interim payments with your staff list and everything is slightly off than what was reported. Obviously, that could affect your interim payment amounts a lot. Also, just like Andrew spoke to earlier, always making those direct replacements and filling those vacancies as early as possible. So that will kind of shorten that gap of having a spot on your staff list just, again, vacant, meaning you can't report costs for that service type or job category. So always ensure you are making those direct replacements as soon as possible once you do hire somebody, so it doesn't affect, again, your annual cost report. Okay, I think we can go to the next slide. Okay, so kind of shifting views to the RMTS side. So with the annual cost settlement, that statewide average of the RMTS percentage does get used in that calculation. So appropriately training staff on how to answer moments. Down at the bottom, you can see kind of the three main questions that they should be able to answer and be trained on, of why these services are being delivered, where are these services prescribed, so what type of plan of care, as well as where that documentation is saved so they can reference it, and also how is that information articulated in an RMTS response. So making that that response to their moment as detailed as possible with the information that will allow PC to code that moment correctly and have it go towards, if it is a direct service, that direct service portion of moment. So always important to train staff members on moments, specifics that they need to put in there, things like that. Again, so those moments are accurately captured. All right, I think we can go to the next slide, which will talk a little bit about free care side of things. So just that middle question that I spoke to a few seconds ago regarding what type of plan of care. So over the last couple of years, you probably have heard us say this a bunch, but kind of training is very important for those providers answering moments, especially with free care, because they will have to know what type of plan of care that student was on. So if it was on a other medical plan of care, like a safety plan, providers knowing that they should answer those moments appropriately based off that is very imperative. Because similarly to the direct service RMTS percentage, there is also a free care RMTS percentage on your annual cost settlement as well. So again, FY21 is that first year that you'll see free care on your annual cost report. So if you do have any questions on that, just let us know, and we can kind of answer where all that data is coming from. But again, all the same important reminders that I talked to in the last 2 slides still do apply to free care as well. Understanding that service prescription and delivery, and translating that information onto that provider's moment response is also very important. So with this, there is a lot of coordinating efforts, obviously. So it's always good to brainstorm ways to improve internal processes of how to train staff, how to get maybe your RMTS response percentage a little bit up. So we always recommend reaching out to your stakeholders or neighboring districts to kind of see what they may do to ensure, again, either that 85% or higher response rate. So always good to reach out and get a few ideas of how other districts do it. So any questions so far at all? Not seeing any. Okay, I think we can go to the next slide, which is just kind of, again, tying everything back together. So again, on the different department coordination, we do recognize that in any given quarter, you all are handling different program actions relating to different time periods. So we just wanted to put that, kind of graphically lay that out. So in the purple/pink items, those are going to be program actions for past time periods. So mainly your cost reports. You also have your desk review and comprehensive review, and then cost settlement as well. And then in the blue, it's just for the current time period. So staff list certification, calendar certification, answering those random moments, and also receiving your interim payments, which there's not really a district action on that, but again, it is kind of a program event that happens. So that's all happening in the current time period. And then the bottom right in the turquoise color, you have just establishing your interim payments for the next year, which again, PCG and the department calculate prior to the start of every school year. So just wanted to lay that out. And then on our next slide, it kind of goes into, again, coordinating with different departments. So looking forward to future SBL certification, you have to know who is still working at the district. So again, checking with HR to see if anybody has left, so you can make those appropriate changes to your staff list. There could be changes in job duties. Maybe someone's not doing as much direct service anymore, so you may have to switch them out of that staff list, things like that. So on the financial side, quarterly and annual cost reporting, again, documentation retention, RMTS participation. It's always good to, again, check with HR, I would recommend, just in case someone was accidentally left on the staff list so you don't over report on your cost report. Always good to, again, check with HR regarding those types of things. As well as understanding program methodology with the change in accounting methodology between the quarterly and annual cost reports, as well as working with your transportation department if you do report transportation to ensure they're tracking the right items and data points, and they're giving you all the necessary details on the documentation they send you. So again, working with different departments is very imperative to be successful in this program. It's always good to keep those relationships. So if we go on to the next slide. All right, so just kind of continuing on with a few items, certification of upcoming staff lists and calendars. Again, training those time study participants, and obviously, again, communicating with different departments, again, with HR, If someone has left, you know what end date to put for them, again, to capture that appropriately. Desk reviews and comprehensive reviews, documentation retention. Really, once you finish your annual cost report, you should be aware that your desk review is going to shortly follow. So any documentation you use to fill out that cost report, it's always recommended and best practice just to keep that nearby in case we do have any questions on your desk review. Okay, I think we can go to the next slide. And any and all questions, we do have a bit of time left, so it truly does not even need to be about kind of the topics we're talking about. If you have any just general program questions as well, we can help answer. Okay, so here we just have the program resources, always available on the department's website, as well as a PCG claiming system. You have your program calendar that will have all the district due dates for the program for an entire fiscal year or school year, and that will be updated for the FY23 year in a few months. So always recommend either downloading that or actually printing it out, and just having it nearby so you can again work with your various departments to make sure you're on track at different points during the year. You also have newsletters and the staff list decision tree, all good resources. And these resources are always available to you all throughout the year. There's not really anything specific that needs to happen for you to access any of these. Any point during the year you want to take a look at recorded trainings or anything, you're more than welcome to as well. And then on the next slide, we just have our contact information for this CDE department and PCG. So you have our phone and email addresses as well. So always reach out if you do have any questions. We do like to hear from you and want to be aware of any kind of major happenings at your district, just so we can kind of help you mitigate any negative impacts that it might have. So staff pool list turnover is a perfect example of, again, it could affect your interim payments, could affect your reimbursement. So that's definitely a key one. You should always reach out to us as soon as possible. But we'll hang out on the phone for 10 minutes or so in case there are any last questions. If you want to come off mute or have a specific question you want to ask, we'll be here. But if not, just want to thank you again for everybody for attending. And there will be a recorded version of both of the training sessions in case someone at your district was not able to attend. That should be available next week or the week after. But yeah, thank you again for attending.